Hi, my name is Mandy Beers. I'm the director of the Rehabilitation Department. I'm going to be going over ergonomics and safe patient handling today. So for ergonomics, you always want to make sure you do a couple of things when you're moving patients. You want to be sure and keep your back straight, and you want to use your legs to help move patients, not lifting with your back or your arms. The beds are made up with draw sheets, so every bed should have a draw sheet underneath it. When you use a draw sheet to move a patient, you want to hold the draw sheet as close to the patient's body as you can. And when you get ready to scoot the patient up, be sure to ask if the patient can help. Ask them to either grab the rails to help pull or to bend their legs to help push. Make sure your partner also has the draw sheet close to their body. When you get ready to move, you want to shift your weight from leg to leg, not lifting with your arms. Always have a partner with you. Don't try to move a patient up in bed by yourself. When you're done working with the patient, always lower the bed back down to its lowest position for safety. Now, as far as safe patient handling, we now have equipment here at the hospital. It is located on Tower 2, 5th floor. Right beside the elevators, there's a door that says lift equipment. You will find the machines in there. Along with the machines, you will also find the slings to use with each piece of equipment. So the lift equipment is located on 5th floor in the room marked lift equipment. The slings are single patient use, meaning you get a sling and it stays with that patient until it's either soiled and can no longer be used, or the patient leaves the facility. When they leave the facility, they can take the sling with them if they so wish, or you just throw it away. The slings on the left side are marked Hoyer, and they're size large and extra large, and everything is clearly marked. On the right side of the room are the slings for the stand assist, again marked large and extra large. There are also sign-out sheets for the equipment located in the room. There's a clipboard for each piece of equipment. You will sign out which piece of equipment you're taking, what floor you're taking it to, and then when you bring it back, you'll sign the piece of equipment back in. There are batteries on each of these two machines, so you want to make sure that when you bring the equipment back, you plug it back in so that the battery is charged for the next person who comes to get it. So the first piece of equipment that I'm going to be showing you is the Hoyer lift. When you go into the room on 5th floor, it should be plugged in. You will unplug it. To operate the Hoyer lift, you have to rotate the red button to the right. That will allow you to use the controls to raise and lower the machine. When you're done with the machine and you return it back, you want to make sure that you push the red button in. That turns the machine off. Plug it in, and then that way the battery charges and you're not running the battery out. The Hoyer lift will hold 700 pounds, and again, the slings are in the room marked large and extra large. The next piece of equipment is the stand assist. It operates just the same. It has the red button, which you turn to the right, it pops out. That turns the machine on and allows you to use the control. When you're done, you push the red button back in. That saves the battery. You plug it back in to charge. The difference between the stand assist and the Hoyer lift, the Hoyer lift is for those patients who cannot sit up on the edge of the bed by themselves. They're a total assist. You use this to lift them. The stand assist is more for those patients who do have sitting balance. They can sit on the edge of the bed, or perhaps you got them up to a bedside commode and they just sat too long and now they don't have the strength to get back up. This lifts them from a sitting position to a standing position, and then you can just wheel them back to the bedside. The weight limit on the stand assist is 500 pounds. The next piece of equipment is the Mary Walker. The Mary Walker is for those patients who are somewhat mobile. It's great for our little confused patients that keep trying to get out of bed. We don't want to physically or chemically restrain patients if they're agitated and trying to get out of bed. A lot of times they just need to get up and move. So with this, they have to be somewhat mobile to be able to stand and get inside. So they will sit. This closes and snaps. There's a strap that comes between their legs and hooks here. So if they were to lose their balance, this will keep them from going to the floor. They can sit, they can stand, they can walk with their feet, they can stand and walk. They can sit again. A lot of times people just need to get up and move, and then it helps with their agitation, and then we don't need to use a restraint. Thank you for watching. If you have any questions, please don't hesitate to call the rehab department at extension 5131. Ask for Mandy, and I would be happy to go over any of the equipment with you and answer any questions you have. Thanks.